Welcome to Dr. Jeffrey Roth's Looking Good and Feeling Great podcast, live from Las Vegas, with his co-host, Darrell Craig Harris.
Welcome to a new episode of Looking Good, Feeling Great with Dr. Jeffrey Roth. How are you doing, Doc?
I am absolutely fantastic. So I can't believe they're letting us keep doing this thing.
I know. Yeah, we have several episodes and actually seasons now. We're over 200,000 downloads. It's very exciting.
It's very exciting. And thank you for all of you who are actually listening in, either on the treadmill or on the way to the office or wherever you will go ahead and get us. Thank you very much for downloading us, and hopefully continue to try to at least entertain you, if nothing else, about plastic surgery and Las Vegas and all that kind of good stuff.
Absolutely. And so many topics that we've covered. One topic we were just talking about was injectables. Sometimes the downside, because everybody focuses on the positive, and there's lots of positive. But let's talk about that a little bit.
Absolutely. So yeah, this is a question that was posed to us. And again, if you have questions in the listening audience, please ask them, because we do want to tackle what you want to hear. And I'd rather you spend 20 minutes with me than 20 hours on the internet, right? So the question we have on the subject of injectables, and there's lots of good and upside, but what are the downsides of the injectables? And by injectables, we mean Botox and fillers and all that sort of thing. So having said that, is one, it's important to be safe and to go to an injector that's safe. And the patient itself has to, him or herself, has to be safe, meaning we always go ahead and do a history and physical exam and really try to make sure that everybody's prepared for this. So, because you really have to go ahead, in my opinion, and treat this with respect. And it's a procedure, et cetera, and so try to get your ducks in a row so as to make the best possible outcome happen. So, okay, so injectables. So we're talking about Botox fillers. Now, with any procedure, you're always looking for the big three, right? So complications, which would be bleeding, infection, anesthesia complications, right? So bleeding is, in this particular case, would be bruising or that sort of thing. And that's why when you come in with me, is we ask about your any recent things going on medically or surgically. But then we also ask about things like medicines, those folks that are on blood thinners. We also ask about aspirins, ibuprofens, which can also precipitate bruising and bleeding. Then we also talk about things like fish oil, St. John's wort, those sorts of things that can also precipitate bruising and bleeding. And when I was up in the Bay Area, UCSF, when I did my plastic surgery training, this was back around the year 2000, and people were really getting into the herbal stuff, et cetera, and we would take these folks to the operating room, and we would be doing our thing, and they would just be bleeding from, just kind of oozing, not from one particular spot like a little artery pumper, but just kind of this diffuse ooze. We're like, what the heck's going on here? So we get it all together, and it's fine, and the patient does fine. And then you wake them up, and you talk to them later, and like, oh, well, yeah, I grow St. John's wort in my backyard, and I ate a bushel of it before I came in that day.
Don't think about this.
Right. And then, of course, 1/3 of, back then, 1/3 of San Francisco was Asian. And so many folks went to their traditional practitioners and thousands of years. And so you have to ask about that as well, because those folks, they may also give the patient something that may cause bruising or bleeding. So that's why I kind of take a history about that. So that's the bleeding part of it. Anesthesia, usually all of the stuff here at this office, the Botox fillers and such, we don't have general anesthesia for. But we also ask about local anesthesia, because we like to go ahead and do dental blocks and that sort of thing. And then also it kind of gives me a good idea of the health of the patient. So for me, we ask a bit about anesthesia as far as that goes. And then infection, we always talk to the patient. We take a look at their skin, make sure there's nothing going on there as well. And so bleeding, anesthesia complication, infection are the three things that you look for. People ask, hey, can I get an infection from Botox or fillers? That happens, thankfully, very, very rarely. In my 20 plus years 25 years of injecting, how that happened, of injecting stuff in the face, I've really only seen two patients that have gotten some redness. I don't know if you call it an infection or that kind of thing. And we put them on some oral antibiotics and they were fine. But thank God, nothing that we would have to admit them to the hospital for, or debride, or any of that sort of thing. So those are the big three things of any sort of procedure. surgical or even a sharp pointy needle going into you, that kind of thing. So that's the kind of the overview, but that's why you try to go ahead and obtain a history from the patient. Hey, what's going on with them medically? What are they taking? And then the physical exam as well. Again, the nice thing about board-certified plastic surgeon, and again, I'm biased, is one is we can fix stuff that goes wrong, usually, but even better, sometimes we can identify things before they go wrong and say, wait a minute, you're on Plavix, you're not getting surgery today or Botox or filler today.
Right. And that's a big topic with plastic surgery, really in general, right?
Sure. So yeah, so we're that's kind of we're kind of keyed up to kind of to hear all that. So on to Botox versus fillers. Now, Botox, again, very, very popular, been around for a long time, used to be for strabismus, which is a spasm of a eye muscle. And then they figured out a side product less wrinkles. And they're like, oh, wait a minute. Let's go ahead and do this for commercial use. So there's a Botox cosmetic, and there's also a Botox therapeutic. Botox therapeutic, more for headaches or for spasm of muscle groups, et cetera, et cetera. So, but what we're talking about today is the Botox cosmetic, which we do here. So there are, again, FDA approved areas where you go. And then there's things that are called off-label where you can put the Botox in there to achieve what you want. And again, as long as you're a medical professional and basically there's papers behind you, et cetera, that's all kosher. You don't want to go ahead and sticking stuff in crazy places and without the anatomy knowledge, et cetera. So what can happen during a Botox injection? Well, a couple things. One, again, bleeding, infection, anesthesia complications. Okay, we talked about that. Two is specifically for the Botox part, you want to be cognizant of a couple things. The most common thing that I see with injectors is that people will get their Botox and they'll say, gosh, doc, I went to this place and I felt really heavy and my eyebrows kind of came down and it wasn't a good experience. So the move you make on the physical exam is basically I tell people to close their eyes and I say, go ahead and relax, pretend it's 10:30 at night, you just want to go home, right? And then I'll put my thumb right above their eyebrow. And you'll see that as people really relax, et cetera, their eyebrows will kind of droop a little bit. I put my thumb there on the forehead right above the eyebrow, and then I tell them to open their eyes. And typically they'll open their eyes, and the eyebrow will be lower than when it usually is, and their muscle may be fighting against my thumb a little bit. What's going on there is usually those folks tend to have a little bit of extra skin in the upper lid, and your forehead muscle, your frontalis muscle, is moving your eyebrow out of the way and the eyelid out of the way so you can see better. So if a very first go around, you completely wipe out somebody's frontalis muscle, that's where you're going to go ahead and get that droop from and that heaviness from, et cetera, et cetera. So we try not to have that happen. Oftentimes, somebody who's the first timer with me, I'll say, hey, let's go a little bit more conservative with the frontalis muscle, and then we can bring you back in a couple weeks, et cetera, to see if we need to go ahead and do anything about that. And that usually works out pretty well. So that's the kind of heaviness. Now, remember, it takes about 4 days for the Botox to work. And I'm just saying Botox, but basically any of the neuromodulators, right? So there'll be Botox, Dysport, Xeomin, all three of them, and they're all good drugs, and they all do a good job. So okay, but Botox is kind of like Kleenex, and basically it's become the household name for it. Okay, so that's the Botox in the forehead. It usually takes about 4 days to work, and so people run home and go, hey, it's not working. So it usually takes about 4 days to work. The first timers tend to say, yeah, I feel a little heavy. I may even have a little bit of a headache. And that's very normal for folks to have a little bit of, because now your body, your muscles are trying to fight against something that is not moving anymore. So it's a little weird. So usually about 2 weeks is what you have as far as that goes, as far as the Botox goes. The other thing about Botox is the no-fly zone. I call it the no-fly zone. And it's in the mid-pupillary line. So you have your pupil, right? The dark part of your eye. And then if you go straight up above the orbital rim, above the eyebrow, and you go a centimeter on one side and a centimeter on the other side, that area there I call the no-fly zone. Why? Because you don't want to put any Botox there, because there's a muscle called the levator palpebrae, which is kind of like a hook, and it actually hooks onto the upper lid of your eye, and that's where the crease is, and that's basically that muscle fires and opens your eyelid, right? So if you get Botox in the levator palpebrae, oftentimes the lid itself will come down, and that's no bueno. Nobody likes rocking that look. Yeah. So and there's drops you can take to help it, and eventually it goes away. The nice thing about Botox is it doesn't last forever, and the bad thing is it doesn't last forever. So that's kind of how that goes. So that's the no-fly zone. You typically don't want that in the face, and that's why you really can't raise the eyebrow in the midline up, because that anatomical space. Now, you can go lateral on the eyebrows, way lateral, still get a little bit of the orbicularis oculi, which is the muscle that's around the orbital rim, the eye, and you can get a little lifty out of that. We call that the little lifty thing. I got to come up with a better.
Is that the technical term?
I gotta come up with a better name for that.
I like it.
Yeah, so
stick with it.
The little lifty thing, people love it. So anyway, and so sometimes that can be beneficial, but that's also the reason why you can't really do a ton of lifting per se of the brow with Botox per se, as far as that goes. All right, so those are the kind of the Botox ones, and of course there's always having Botox fade where you don't want it. For example, it may drift a little bit, and again, you don't want to put it. It usually stays put right where it is, but you want to have a little bit of a margin so you don't get the levator palpebrae, et cetera, et cetera. So that's kind of the Botox stuff. Where you have more complications are those areas, and again, this isn't cosmetic as much, is where you're putting it in different spots, and you have bigger vessels or bigger nerves right in the neighborhood, and you try to avoid that as far as that goes. So that's the Botox downsides. On to fillers, and by fillers, there's all sorts of fillers nowadays. There's the hyaluronic acid, there's calcium hydroxyapatite, which is basically kind of liquid bone. There's the Sculptra. There's all sorts of stuff out there nowadays, and some of them have a better safety profile than others. But it's also, the wizard, not just the wand, in my opinion. Try to do history, try to do good physical exam, kind of see and listen to the patient. And sometimes it's okay to say no. It says, look, I can't pull that off. Or we can do this, but what you really need is surgery, et cetera. But the fillers, basically, again, bleeding, infection, anesthesia complications. With the fillers, it's more viscous material, because basically with the nasolabial folds, you're caulking a crack, right? As far as that goes. And so there's a little more volume to it, and it's a little thicker volume, et cetera. So again, you can get, bleeding, anesthesia complications, infections, but very, very rare, thank goodness. And by bleeding, I mean typically a bruise or something along those lines. Under the eyes tends to bruise a little bit more. Lips tend to bruise a little bit more. So that's kind of where that is. The things that you don't want to happen, which precipitated the question, is, hey, can you take down an artery, and can bad things happen with injectables? The answers are yes, and thankfully they're very, very, very rare, but they do happen, where if you're injecting and you happen to inject into a vessel, that little globular entity may go flying into a vessel that you don't want it to be there and occlude it. And then if things distal to that artery, especially if there's not a lot of collateral flow, may not do well. So whether that could be skin, whether that can be tissue, whether it can occlude the artery that goes to your eye and cause blindness. Yeah, these things have been documented to happen, and they're awful and they're terrible. And so you try to be as cognizant as you can for all of these things.
I mean, that's also the reason why it's so important to have somebody who's very well trained.
Yeah, so I think that's
seems obvious, but that's
well, yeah. But I'm glad you bring that up. In as much as you want somebody who's trained well and who's experienced and knows when to say no, or knows when to say, this is beyond me, and that's okay. I refer stuff out all the time because I'm trained to do a ton of stuff, but hey. When it comes to a cleft lip or palate or whatever, I send it to the university here in town. They do a great job of it, and it's better for the patient. It's better for the kid. I used to do a ton of breast reconstruction, et cetera, et cetera. I don't do as much of that stuff anymore. And there are some guys and gals in town that are phenomenal. And my litmus test in my head is what would I tell my wife? What would I tell my cousin? Okay, right. Well, then that's what I tell them.
And that's a great place to come from.
Yeah, that's my litmus test as far as that goes. So now fillers are awesome. Like it says, back in the day when I very first started out, we just basically had collagen, Zyplast and Zyderm for those folks that are listening and are old school like me. But now we have the HAs, the hyaluronic acids, which are very nice. You've probably heard of, your Juvederms, your Restylans, that sort of thing. They're really nice because they're gel-like, they're squishy, they're a little bit malleable, they're soft. Most of the time you can reverse them if you get into a bind. So that's all good stuff. Yeah, so Botox will typically last about 4 months. Now, my hypermetabolic folks, the folks that are in the gym twice a day, et cetera, they tend to burn through it faster. Also, my folks that are very expressive, my actresses, hi, how are you? Welcome. They tend to go ahead and blow through it a little bit faster as well. The fillers, it depends on the type of filler. Your HAs, your hyaluronic acids, can range from 6 months to a year. There are some other HAs that can last 2 years. That would be your Volumas, et cetera, et cetera. It's a bigger molecule. You put it in a little bit deeper, and it's more for the cheeks, et cetera, et cetera. Those tend to last a little bit longer.
Is there a cost difference between those products?
Yeah. So there's a little bit of a cost difference, and where you're going to put it. Typically, you don't want to put big molecule stuff really superficial, because then you get this thing called Tyndall's effect, where it looks a little bit grayish or bluish underneath the skin. So again, it's hopefully
it's experience and knowing, right?
Yeah, well, and proper training. You know what tool for the job, right? So, hey, I'm going to go ahead and enhance somebody's cheeks. Okay, well, I'm going to use this tool. Oh, and they want the lips. Oh, okay, well, then I'll use the other tool. And that's fine.
Right. It's a bit of being a car mechanic, knowing which
100%.
Which I know it's a really basic analogy, but I think it's important for people to ask those questions too. And that's an awesome thing. We'll be giving this kind of background helps people make informed decisions, I think, right?
No, 100%. So an informed patient is always better. And there's so many things out there now. Some stuff, to answer your question, can be 2 years, and that would be your calcium hydroxyapatates, that would be your Sculptras, that would be sometimes the Volumas. But again, people say, well, geez, I wish I had something that's permanent in the face. Not really. You typically don't. And I say that from experience, in as much as back in the day, and still in some cases, people will go ahead and inject silicone in the face, which for cosmetic or aesthetic purposes is a bad idea. And in fact, it's illegal in Nevada, which is a good law for aesthetic purposes, because your face changes, but the silicone doesn't. And I don't know how many times I've taken silicone out of faces because, again, it may move, it may travel, it may come towards the surface, it may do that sort of thing.
Things you don't want,
right?
Essentially.
Now, some stuff, like, for example, chin implants, okay, that makes sense. And because you're fastening it down to bone and it goes ahead and really solidifies itself. Yeah, that makes sense.
It's not going to migrate.
Yeah, so yeah, or it shouldn't. But yeah, never say never in medicine. Tell you. Yeah.
Less likely.
Yes, right. Yeah, because, the surgery will keep you humble.
Yeah, I can imagine. Yeah.
So, yeah, you do everything right, and you still, as things make a left turn, you're like, we did everything right. So it happens. And that happens too, is basically you can be a terrific injector, you can have a terrific patient, and you guys do everything right, and still something wacky happens. And yeah, it happens. So then the next thing is, all right, well, what happened? And then, you go ahead and you go through it and say, all right, well, how do we not have that happen again? But in the meantime, what are you going to do with the patient? How are you going to get them through whatever they need to get through, whether it's a asymmetric eyebrow? Okay, that's a fairly easy fix. Versus a drop lid versus tissue necrosis, which is a whole different, sort of ball game. Then you get called upon again for, critical thinking and solutions to the problems. And then again, a partnership with you and the patient, like, okay, so here's the issue. Here's the solution. Let's work on the solution together.
Yeah, because it really is. I mean, you mentioned that as a partnership. It's not really you treating somebody. It's you doing that with somebody, them being honest with you, telling you, like you mentioned, the medications they might be taking, and then you do your portion, and then you arrive to what's best for the patient ultimately, right?
Right. And this stuff is elective, right? It's not a gunshot wound to the chest, et cetera, where you got to go, So So we have typically the luxury of time, and usually we're able to go ahead and put ourselves in the best position possible. So again, like anything else, and I'm talking about all the bad stuff today, but having said that, those are all things that are always in the back of mind. But if the stuff wasn't safe and if it wasn't effective, it wouldn't be the most popular things that we do. It's by far the most popular aesthetic or cosmetic, quote unquote, procedure out there is Botox and fillers.
Well, and they all have a good track record at this point. They've been in use for many years, and that's an important point.
It's a very important point. And the FDA, and people, make fun of the FDA and, the Federal Delay Administration and all that kind of stuff. But they do keep bad stuff away. I mean, in Europe, there's literally hundreds of fillers, et cetera, and some are great and some are not, just like anything else. And they really have to, run the gauntlet here to get approved in the United States. And we can argue if that's a good thing or a bad thing. But by and large, the ones that are out here now in the right hands, people can feel pretty assured that it's going to be safe, it's going to be effective, and they're not going to come out. Odds are they're not going to come out goofy or harmed or that sort of thing.
Yeah, it's ultimately what's best for the patient. And is there a typical age that you're seeing? Is there like a demographic that's most common for those?
That's a great question.
I mean, I would kind of assume something, but maybe I shouldn't.
Yeah, so Botox, it's funny because the line keeps getting erased and redrawn. In as much as Botox used to be for 50-year-olds and some 40-year-olds, and then the 30-year-olds started showing up.
And TikTok and Facebook.
Then, exactly right. Then your TikToks and Instagrams and stuff like
and
that.
Zoom meetings.
Yeah. Zoom meetings, 100%. Yeah.
Which we've even talked about.
Oh, yeah. No, 100%. So people that you're staring at yourself for 8 hours a day.
Right.
Gosh. So, yeah, if you're Bo Derek, that's great. If you're me, no, probably not. So now with, like you says, is everybody has a screen in front of them, and everybody's on TikTok or Instagram, and everybody's using filters, and everybody's doing that. And so we're getting, 20s people coming in here, and I'm like, why are you here? And so oftentimes they'll say, oh, I want to go ahead and prevent things before it starts. And there's an argument for that. And again, you don't want to make them look goofy or weird. And that's the Botox. Fillers, even more so, because now folks want, the liquid rhinoplasty, the liquid facelift, which basically is filler in certain areas to try to enhance those areas. Gals also want lips, and thankfully that's calmed down a little bit. For a while there, these folks were coming up with really...
It gets a lot of control at times.
Really big, crazy lips.
Right.
And I think that's kind of calmed down a little bit. And most gals want a little bit in the pillar and a little bit in the pout, sort of thing. Especially when they're younger. The older folks tend to like that too, but are there mostly to get some filler in, to get a little bit of volume in there, to take down some of the vertical lines and wrinkles. So, but at least now we have something that we could use to actually combat that. For years and years, we didn't. But now we do, which is a good thing. But like anything else, you don't want to overuse it or overdo it. And then again, there's, I like to think some art to it as well. And again, some folks...
Yeah, you're a bit of a sculptor.
Right. So some folks basically, see a picture and go, oh, yeah, that's what I want. Standing in front of you, like, no, you're really a beautiful gal. You really don't need this, or we're going to do just a little bit, but not...
Getting to that topic, what's your guidelines for you personally? And also, is there an age guideline?
Well, yeah, I mean, basically you want to be over 18 for this kind of stuff, right? So, the nice thing about being a plastic surgeon is you operate on, they used to say the skin and its contents, right? Which is a joke, but is actually real. In as much as we operate on babies with cleft lips and palates and with craniosynostosis and all that stuff. Not myself, but like real plastic surgeons do that. And we operate on people in old folks in nursing homes, with decubitus ulcers or cancer reconstructions or hand or burns or whatever the case may be. So to answer your question is they'll come in and we talk about what is now, quote unquote normal. What's the bell-shaped curve, right? So even for breast dogs or something along those lines, this is okay, doc. Well, I want to go from an A to a C. Okay. You want to put yourself in proportion with your hips and shoulders. Okay, great. And then some girls come in and go, hey, doc, here's the picture. And they're, they come in with, Wendy Whoppers or whatever the case may be. And so for me, I'm like, okay, this is not quote unquote within normal limits. So we're making a aesthetic choice now. So if you like the aesthetic and you want to do the aesthetic choice, then we have to recognize that. And then there's going to be an upside and a downside. And I tell folks all the time, again, breast dog is a pretty clear thing, is some girl that's had 8 kids and their breast or inframammary fold, which is where your breast meets your chest wall, is naturally really low. And then that happens on some folks. I'm never going to be able to achieve, even with all my Frank Lloyd Wright architecture, right, and internal bras and the breast where you can put a drink on top of it. Right. So again, it really sort of depends on.
And you don't really want that.
Right. So,
obviously.
So
they may think that, but maybe, like you said, when you're really explaining the options, then maybe it enlightens them a little bit.
So here we try our best to educate as best we can and really think and talk to the patient of like, okay, what's the motivation? What are we really doing here? Okay, this is why. Okay, great. And then try to fit what they want to reality, or at least what I can come up with, reality-wise. And so we have people bringing pictures, and especially the young ones, they always have, pictures because they're on their phones all the time, et cetera, et cetera. But then we have, again, that discussion of, okay, this person that you have in your phone that you want to be like, she doesn't look like that because of all the filters and all of the photoshopping and all the da-da-da-da-da. I said, I can guarantee you if we show up at her house when she's getting ready for work, she doesn't look like
that. And that person that they're idolizing may have had actually several plastic surgery.
Oh, sure.
I mean, these days it's not uncommon, and we can. Right. The one gift of social media is you can see the timeline. Where they started, where they ended up, which is not a bad thing, but that's
photographic evidence. So,
So
thankfully that wasn't around when I was like in high school and college.
Exactly.
So I was a good kid, Dad. It's all right, really.
Promise.
That basically is that. So to answer your question is yes, we are seeing folks come in sooner and sooner, and I think it just depends on the maturity level of the patient as well. And hey, I've had folks that are, grown adults and they want crazy stuff. Or I'm like, look, I'm not your guy. And that's okay as far as that goes.
Right.
So,
and I think, also too, part of, with Botox and those kind of things is something you could actually start with is really taking really good care of your skin to alleviate a lot of issues, right?
Sure. Well, again, be a healthy person. I mean, okay, once in a while, have a piece of carrot cake. Really, it's okay, right? I mean, so, please. But having said that, is folks like, oh, I'm never going to smile again. I'm not ever going to drink out of a straw again. Live your life, okay? But there are some things that obviously will hurt you. And smoking, number one, and a lot of sun exposure, lots of sunburns, et cetera, et cetera.
Suntan booths.
The UV light, just terrible. Yeah. So those are the two that really go ahead and mess up your skin. And we really see that, to your point, on the skin and the UV rays and stuff. And my office is in Las Vegas, Nevada. And, back in the 80s, it was all about, Hawaiian Tropic, and the girls with baby oil, and the nurses were the worst because they would put the iodine in the baby oil and just cook themselves. So now everybody's running around, getting little basal cell carcinomas and worse taken off of them. And I used to make fun of the guy under the umbrella, but now I am the guy underneath the umbrella. These kids, we made fun of the Hispanic women and the Asian women that walked around with the umbrellas, and they're absolutely right. So they were way ahead of it.
They age better than anybody.
They got it right. So like I have a little daughter, and her swimsuit looks like a burqa, right? It looks like it's from the neck to the sleeves to the ankles, and my wife's like, really? And I'm like, she'll thank me when she's 30. So, and we see that in the operating room, especially folks that live at the beach or everything else like that, and they've been in swimsuits and stuff, and they come in for surgeries, and you can just tell the difference between the area that never got exposed because it was always under a swimsuit to the area that was always exposed. And really the skin in of itself is really like night and day. So again, the main things we all know what to do is, a lot of water, stay out of the sun, please don't smoke. And then the rest of it is, skincare, which is awesome. And we have some terrific stuff here in the office. And
we actually even have your own sun protection line.
So basically, it took me 17 years to finally get it, I think, right. It's a really good sunscreen, and we called it really good sunscreen. And it's a zinc and titanium base, which means it's more like a shield than a sponge. And so it reflects the UV rays off. And even people that have had laser resurfacing can go and put it on. I put it on my little girl. And so I think it's terrific stuff. And I think everybody should use, if not mine, then something very similar to that. Because again, I think if we can create a little UV light, 20 minutes a day, you go outside, you walk around, stuff like it's good, for the pineal gland and vitamin D and all that good stuff. But the repeated effects of it really can take its toll.
Yeah, it just really ages your face. You can avoid a lot of those injectables. At least with Botox, it can help if you really just take care of your skin as a beginning point, and then it's available.
Like anything else. Yeah. And then, of course, you throw in genetics and dumb luck. And,
exactly.
And then... And that's what
you can't fight genetics, that's for sure.
So, but all things considered, you do the best you can. You try to, you have to be aware of the downfall of things and then try to avoid them best you can. And if you can't avoid them or they just happen, then yes, you go ahead and address them and try to get the best outcome.
Yeah, and there's a lot of great options. And like you said, with a really long track record, which is amazing. Tell people how they can find you online.
Absolutely. We're all over the place. So our cornerstone is the website, which is www.jjrothmd.com. That's JJROTHMD.com. And on there, we really set it out to be educational and informative. So there's lots of blogs, there's lots of material. And if you don't see something, call the office. We answer the phone. So you can give us a call at the office. And then social media-wise, obviously, you're listening to me, so we are all over the podcast space, but we also are on the social media space, Instagram, Facebook, Twitter, LinkedIn, TikTok. Yeah, we're all over. And so, if you have any questions, because this whole episode came from a question today, please do ask, because we love questions and we love getting good information out there.
Right. And our social media is at Las Vegas Plastic Surgery. So just search for that and you'll be able to find us. And shout out to our producer in France, Nigel J. from Voice Rap Studios, does a fabulous job, has been helping us all along the way. And have an awesome day.
Have a fantastic day. We'll see you soon.
Thank you so much for joining us. For further information, please visit the podcast website link for Dr. Jeffrey Roth. See you next time.